Well, welcome to the Logan Mason ROSC meeting. Today is December. It's not December. Oh my goodness. I don't know what month we're in today. We are in November, November 20th, 2025. Let me share my screen. All right. So, today we are virtual, but also in Mason City, Illinois at the library. So thank you, Tyler and Bryson, for being in person. And thank you everybody who's joined us online. So welcome. So today's agenda, so we are going to talk about just a review of what our ROSC and what our mission is, introduction, so our name, our connection, what are we are most grateful for, updates with our and local meetings, harm reduction resources. Then we have a highlight with the Oxford House at Bryson, and then what we have coming up next with RA and upcoming events and more. So just a little recap of what a ROSC is. So ROSC is a coordinated network of community-based services and supports that is a person-centered and builds on strengths and resilience of individuals, families, and communities to experience recovery and improved health, wellness, and quality of life for those with or at risk of substance use and or mental health challenges. The central focus of a ROSC is to create an infrastructure or systems of care with the resource to effectively address the full range of substance use and or mental health challenges within the communities. So with our personal Logan Mason ROSC mission statement is improving access to health, wellness, and holistic recovery options for people who are at risk of or suffering from substance use disorders while educating and connecting Logan and Mason counties to reduce stigma and improve recovery outcomes. So, while we begin, we are going to do introductions. So, today we're going to do name, your agency and affiliation, and then what you are thankful for. So, think about that. So, I will start. So, my name is Grace. I am a prevention coordinator here at Chestnut Health Systems. I am supervising the Logan Mason ROSC, and I'm also supervising the substance use prevention grant. I help support the Livingston ROSC grant, and I'm also help supervise the base grant. So what is one thing that I'm thankful for? I am thankful for my friends and my family and my beautiful, wonderful puppers, Clo. She's the best thing to wake up and snuggle to in the morning. Because every morning I don't get snuggles from her, when I'm not at home is really sad. So when I am home and she is sitting there at the end of my bed and is like, "Are you awake yet? Is it snuggle time, Mom?" I'm like, "Okay, yeah, come on up." It's the best thing in the morning, and then she makes it very difficult to get up. But so we'll start online and then go in person. So we'll go with Kara, Lacey, and Silas, then Abby.
I'm Kara Davis. I'm the Director of Nursing at the Logan County Department of Public Health in Lincoln, and I am most thankful for my children.
Sorry, I was muted.
You're
Hi,
good.
everyone. My name is Lacey. I am the Health Equity Coordinator at the Epilepsy Foundation of Greater Chicago. We serve 44 Illinois counties, including the Mason and Logan counties. Yeah, great to be here with you today. One thing that I'm grateful for is my family and also all of my wonderful friends that I have and my cat. That's actually multiple things, but
You're good.
I'm Silas Taki. I'm the CSBG coordinator at Community Action Partnership of Central Illinois. I am thankful for music.
Hi everyone, my name is Abby Behrens and I am the Central Region Prevention Specialist with Prevent Child Abuse Illinois. I cover 52 counties from below DeKalb up down to Effingham area. I am thankful for, I mean, all the things like your kids and family, whatever, but like I'm feeling just extra thankful for my job as far as like the flexibility goes. I'm just really grateful for the opportunity to be doing something I love and being able to like work from home and enjoy like my coziness. And you can see my Christmas tree behind me. I just love this time of year. So super thankful for that.
Awesome. Thank you, everyone. All right, let's go with Cami, Lori, Danny, Sandra, then Carmen.
Hi, I'm Cami Garrison. I'm the technical assistant with the statewide ROSC project serving Region 3. So I'm going to piggyback Abby. I'm thankful for all the important things like family and friends and kids and healthy people, but I love my little house. It's cozy and I've done a lot of cute things to it, and I'm just very grateful for it this time of year.
Hi, I'm Lori Jackson. I'm with SIU School of Medicine, the FQHC CIO. Help to support Logan County, and I'm thankful for my grandbabies. I have a new one this year, and he's just adorable and love the 5-year-old as well.
Hi, I'm Danny. I'm the community health worker for SIU Family Medicine in Lincoln. And of course, I'm thankful for my family, but right now I'm thankful that I get to decorate for Christmas this weekend, and I'm very excited about it. So,
Thanks, Danny. Okay, good.
Hi, I'm Sandra from SIU in Taylorville. I also cover the Springfield office, so we have some patients from Logan County and Mason County. And I am thankful for my daughter and her entire family, especially this time of year.
I am Carmen Lanham. I am with Family Guidance Centers out of Springfield. I'm on the Regional Substance Use Prevention Integration Center grant, which covers 28 counties across central Illinois, Logan County being one of them. And I am thankful for my mom, my best friends, and my cat.
Hello, I am Amy Hopper with the McLean County Health Department for behavioral health as well as developmental disabilities. So I'm just thankful that all of life's hardships have led me to a place of being able to be grateful today. It didn't make any sense, but it made sense in my head. So just grateful for the person I get to be today.
Awesome. Thank you, everyone online. All right, let's go Tyler and then Bryson.
Hi, everyone. I'm Tyler. I work with Chestnut Health Systems and service Logan and Mason County. I would say what I'm grateful for is probably family and the fact that we're going to be all together next week for Thanksgiving. So I'm looking forward to that.
Hello, everyone. My name is Bryson McFadden. I'm outreach worker with Oxford House. We are sober living homes throughout Illinois. I see over central Illinois, but we have about 4,300 houses throughout the United States. I'm I'm thankful and grateful for family and all that, but first and foremost, I'm thankful and grateful for my own recovery because without that, I wouldn't have anything else in my life.
Absolutely. Awesome. Well, thank you, everyone. So, for those who do not know, Jeanette Davis has found a new position, and has left Chestnut Health Systems as of 11/14, as of last Friday. So, but she did, one of her last things that she did was put together this last presentation. So I want to give her full credit. So this last ROSC, this meeting is given to you all by Jeanette, even though she would be here today being like, no, this isn't me. But this was all her putting this all together. So she did get Bryson as our speaker today. So I'm very grateful for her being a part of the ROSC for the 4.5 years that she was a part of the ROSC. So speaking of Jeanette, the quote that she put in, the success of this group is a reflection of your hard work and passion. As I embark on a new journey, I am confident that Logan and Mason County ROSC will continue to achieve great things. Thank you for everything. So we all love and we miss her, and we'll all pretend I'm not crying. Anyways, continuing on. So we are going to have new cards coming out soon because exciting things are we're getting new meetings. So that was something that she started to work on before she left, but I just hadn't had a chance to look at them. So I will be getting those out soon, and I will need help from my amazing community partners to get those around our community to all the different places. So um, we will get out those very soon, but this is the last updated one. But the majority of the meetings on here are very much correct. There are just some added ones in Mason County that are starting to join in. Next up, we have community resources. We have an online directory for Mason and Logan County. So if you've never been on them, masoncountyresources.org and logancountyresources.org. These are two websites that are managed by the Substance Use Prevention Grant. So Tyler and Dominic are taking full ownership of this. So when I was full-time on this grant, I helped start this up, and now they're taking part of keeping it all updated and making the facelifts and updating the information. So they do a great job of keeping everything up to date. So there are spaces on there if you have a chance to take a look and you notice that there is something that needs to be updated. There's a spot on the front pages of each of those where you can do additions. You can also say there's things that need to be changed or cut out, or if you want to add things to the community calendars that are on there, more than welcome to just hop on those pages, and would love to get any information that we can. And if you have any design, things that you are like, oh, this would be fun to do, more than welcome to let us know. So reach out. These are part of our Logan County harm reduction resources. So you can get Narcan, fentanyl test strips, xylazine test strips, and benzo test strips at the Family Custom Cleaners in Lincoln. There's a table outside the Logan County Health Department, which has naloxone, fentanyl, and xylazine test strips, and some other materials as well. In the Mount Pulaski Library, there is a shelf as well. At the courthouse, there's naloxone in the bathroom that you can snag. Hope on Fifth also has naloxone, fentanyl test strips, and xylazine test strips. And the Logan County Jail also, when individuals are leaving, they will receive a bag that has different resources, but also has naloxone, fentanyl, and xylazine test strips. You can also get naloxone at CVS and Walgreens as well. In Mason County, all three libraries have harm reduction resources, and Mason County Health Department also has harm reduction resources as well. So it's very exciting. We've been working really hard getting all of those, and we look forward to continuing getting more places in our community to having more available resources there. So today, our amazing highlight is our Oxford House, which is Bryson McFadden. So Bryson is one of the most amazing persons out there working with Oxford House, and we are just blessed that he said yes to being our community person to come out and be our highlight today. So we have a house, a Madigan house in Lincoln, Illinois. which was such a beautiful thing to add to the community. And Bryson has just been an amazing resource to continue that relationship and continue that communication between us and the Oxford House and the relationship between the people that have been living there. So, without further ado, Bryson, take it away.
Thank you for that great introduction, Grace. Hi, everyone. As I said earlier, I'm Bryson McFadden, outreach worker with Oxford House. So, uh, quick warning, this is a really long slideshow, so I'm going to try and condense it down a little bit because I know we have other things to cover. But we can go ahead and jump right into this thing. I'm grateful for you guys and thank you for having me. So let me start by saying Oxford House is a 501c3 nonprofit umbrella organization that supplies these individual houses with the charter for them to be Oxford House. And for each house to have a charter, they have three requirements. The house has to be democratically ran, financially self-supporting, and has to expel any member who has returned to use or drinking immediately. It also keeps the house at most minimal risk because a lot of times when one person goes down in a house, if it doesn't get taken care of, they'll drag some down with them, unfortunately. So we have to stand on that one. Also, these houses are gender specific, male or female. We don't have co-ed. The houses must have a minimum of 6 adult beds, and they have to be adherent to the Oxford House model, traditions, and manual. Excuse me. The first Oxford House was opened in Silver Spring, Maryland, 1975. Excuse me again. That was a group of guys that was in a halfway house. That the halfway house was closing down, and they decided they were not ready to be on their own yet. So they decided to just kind of chip in on the bills together, and that has blossomed into this beautiful thing known as Oxford House, which is we are obviously growing, because I said we are about at 4,300 houses now, which is over 35,000 beds, and we are in other countries as well. I'm not gonna say which ones because I don't want to lead you on the wrong path on that one, but we do have a couple in a couple other countries as well. This right here, I didn't have a chance to update this. I would have put a picture of the one in Lincoln, but this one right here was my first home I opened. This is the 100th house in Illinois, Oxford House Terrian. Just to give you guys an example of what kind of homes we do like to open, they're nice large homes, able to comfortably fit anywhere from 6 to 10, 12 people seeking long-term recovery. Um, Give them experience in a neighborhood that a lot of us don't have any idea what it's like living in a neighborhood like that because we grew up in trap houses or streets or just not so good areas of our towns. So this is supposed to give us a whole complete change of everything. The houses, they have to have adequate parking. In a perfect world, everybody's going to get their license back, but you got people that are in the houses that get their license back, and then you got people moving in the houses that don't have it yet. So we just have to make sure that there's adequate parking for the majority of the people at the house. I like to find them close to public transportation, employment, and 12-step meetings. Because again, we are recovery housing. So our first and foremost thing is we have to be working a program of recovery. How are we going to work a program of recovery if we can't really get to the meetings? To be to get into Oxford House, we accept people from all walks of life. Completion of inpatient treatment, medical detox, main, like it says right there, withdrawal-free sobriety. We don't want anybody withdrawing in the houses. Not only is that going to be bad if because we don't have that level of care for individuals who are going through withdrawals, but also it's not triggering to other people in the house. Reentry from DOC, we have a whole reentry subcommittee that my coworkers do an amazing job of working with the prisons and trying to get people straight from prison as well. Again, have to be willing to work a recovery program, ability to pay the equal shared expenses, which is called, it's actually equal expenses shared, EES. And then again, have to adhere to the model and system of operations. To become a member, there's a couple of different ways you can go about it. You can fill out an application online on the vacancy website. You can call a house to set up an interview. when getting these interviews, showing up on time or calling on time for the interviews is a good idea, just like any other interview. Only thing is you're not interviewing with a job, you're interviewing with a bunch of like-minded individuals that's trying to get clean. So everyone's a little bit more open-minded to things. Be open and honest during the interviews. Everything's done on a democratic basis, which means a majority vote, which is 51 or more percent, except for voting in new members. That requires an 80% vote by the members. Um, so minimum of 30 days. When they come in the house, they're on what we call a newcomer's contract. It's a minimum of 30 days where they have to attend at least 5 12-step meetings per week of their choosing, AA, NA, CR, Smart Recovery, whatever 12-step meetings that they choose, it's going to help them, work some steps and get control of their life back. They have a curfew at 11 o'clock during the week and 12 o'clock on Friday and Saturday. Um, they must get a job within 2 to 4 weeks of being in the house. We have a saying, if your job until you get a job is to find a job. So we typically try to have them, be out of the house, actively job hunting, trying to get established in the community. And there's a weekly mandatory house business meeting where everyone pays their weekly shared expenses, talk about bills that gets paid, who's ahead and who's behind on rent, and if there's anything that's going on in the houses, disruptive behavior, people not getting along, somebody drinking my milk, all these different things you can bring them at the house meeting, and talk about as a house, because that's going to be a place where we can give and receive constructive criticism about stuff. This right here is an example of our vacancy website. It's oxfordvacancies.com. Or if you guys want to feel a little adventurous, you can go to our website, oxfordhouse.org, and you can get to the vacancy website through that. But there it has a little bit more in depth of what Oxford House is and some of our materials and stuff. So again, we are recovery housing. So these members are the types that do well in Oxford House. The opioid abuse history, co-occurring substance use and mental health disorders, veterans, drug court participants. We love drug court participants. I'm sorry to say, but I love them. Like they come in and the way they just turn their lives around because they are required to do so much. I've seen some people move in, not even be able to get jobs right away, but drug court has helped them out so they could get on track. And man, they're killing in the recovery game. I love drug court participants. I'm trying to establish a relationship with all drug courts possible. Reentry from incarceration, from prisons, jails, any type of reentry, and people with a history of chronic use. In these houses, there are different house officer positions that is simply just another responsibility that individuals have to help the house run as a whole. None of them hold any power or of any type over another. There's the president who just kind of controls the flow of the meeting and represents the house at the monthly chapter meeting. Secretary writes down everything that's talked about in the meetings and emergency meetings. Treasurer is the one that keeps track of how much money's in the bank account, what bills are coming in, and writing the checks to pay those bills. The comptroller is the person who keeps track of who's ahead and who's behind on rent and by how much. Coordinator is the person who signs the chores. The housing service committee rep, that's kind of like our point of contact for the house. Each house has one. It kind of keeps every house in the loop together. Plus, they help plan like fundraising and unity events and all that good stuff. So the house meeting occurs every week. Parliamentary procedure, principled participatory democracy. Everybody gets a voice, and everybody needs to speak up and share their voice because your voice matters. Finances, chores, recovery, events, all this stuff, like I said, is what we talk about the house meeting. Then on a bigger scale, we have a chapter meeting, which occurs every month. It's typically all the houses within a county or certain area. There's chapter positions just like the house positions, it's just on a chapter level. And instead of having bills to pay, they can put money up towards their state dues. They could put money up for a fundraising event. They could do so much with the money that's brought into the chapter level. Democratically ran as well. Finances, uni event, and also it's like another safety net. If houses are struggling and need assistance and the chapter is doing well, that's another safety net. So the house can come to the chapter and be like, hey, look, we're struggling with this. Can we get some help? And it's more than just financial assistance too. Sometimes it's just having that support of people that get willing to show up and show out for you. There's a lot of people in these houses in these areas that's been around for a while. So if you are having trouble on a house level, reach out to chapter, and then chapter can't figure it out, reach out to the state level. So we are time tested. This year was our 50-year anniversary. The charter, three tenants set the foundation. So when we open a house, we like to have, a couple core members that know the house rules, know the model, and know how to operate an Oxford house. So it's not so hard on us, outreach workers and others that come in to help the house get grounded by training everybody. We have support of chapter. Um, the nine traditions, just like there's traditions in NAAA, there's nine traditions, which ours is kind of stems from that, but it's more incorporated to more at our own house level, and just maintain structure and integrity. The house manual, every house member should have read the house manual, just like everybody that's in the rooms need to read their big book or blue book. Um, it breaks down system operations, and almost every question you could have is in the manual. Chapter support offers community and support. The unity part of community is my biggest thing. The state association, servant leadership and consistency. Just a lot of people on a state level have been around for some time, so it just shows that if you stay consistent with this whole process, it definitely works. And you got people that are out here willing to put in some extra work to help you get there. Alumni support, it gives the new members hope. I always encourage anybody that moves out of the house in good standing, which means they don't owe any money, to stay involved with the house. Because just because you're moving out of the house, your journey with Oxford doesn't have to end there. You can continue to show back up for these houses and show them that, hey, you came in these houses broken and beaten, but you're on top of the world now, and it was all because you followed the rules. Yeah, it gives a lot of hope. Outreach support is the institutional memory of the model. What got us outreach workers here is our involvement with the houses and our knowledge of the model and learning how the rules were and just being of service. And then there's the Oxford House Central Office, which keeps everybody on track. Um, so there's chapter, state, outreach, home office in a quote chain of command type of thing. Areas of concern, lack of democracy, lack of training, member unwillingness, member entitlement. Well, I'll just break it down a little bit more. Lack of democracy, we all know what that means. If they're not, allowing everybody to speak their part and have their voice heard, um, you can't just go up to somebody here, take a drug test. That has to be a house vote. Everything's done on a house vote, so everybody needs to be able to have a say so in whether yes or no, I agree with this, and then majority vote wins, then that's what they go with. Lack of training. A lot of new houses get this. There's people that move in the house straight from treatment. It's never been an Oxford house before that need training. That's another reason why I like to lean on the chapters as well, because they have a lot of knowledge and a lot of experience. Member unwillingness and entitlement. Those we like to call senior members. There's a difference between a core member and a senior member. A lot of times senior members just been in the same house for a while. They know the rules, but they don't really care enough to be involved with stuff. They just basically pay their way and just leave it at that. Lost priority on personal recovery. I always say this first and foremost, we are recovery housing. So the most important thing that we need to do is focus on our recovery. Even myself, working for Oxford, I have to remind myself that I have to work on my personal recovery just as much as everybody else does. Um, Neighbor and public discrimination. I know a lot of times we move into areas that we're not necessarily welcome or wanted in. We don't want to feel that fire, or nothing. So we still move in these houses. We still gotta be respectful. We still gotta be straightforward, upstanding citizens, right? So if neighbors aren't happy about it, then just kind of let them be. I have a house in Springfield that they had write-ups in their little on Facebook pages and everything, and they was taking pictures of them and posting them in there, and they was doing really bogus. But now they cook the baked goods, and the guys at the house mow their yards for free, just to, it's just kind of cool how things come around full circle. Benefits. Members receive peer support, accountability, responsibility. My favorite one is peer support. Again, other like-minded individuals that's going through similar situations, even if they're different situations, they have the same end game, the same goal: stay clean one more day at a time. And you're not alone. Accountability, that's accountability and responsibility. That's where growth comes from. Um, Not all of us had it figured out when we moved into a house. I was a mess when I first moved into a house. So it took the guys in the house, hey man, you need to do X, Y, and Z, why are you not going to your meetings? What's going on here? That little bit of accountability goes such a long way. And responsibility, in our active addiction, we have no responsibility except for to fuel that addiction. So in Oxford House, I've been given enough responsibility to know how to balance a checkbook, how to manage my own house. If I was to go get my own house today, I know I'd be able to successfully pay the bills on time. I know I'd be able to do everything I need to keep my house afloat. Safety and stability. Oxford House is a safe home, a safe roof over our heads while we get grounded in our recovery and get grounded in the community. Same stability. There's a greater chance of success. I know it says on the later slide, but I think that number's wrong. We're closer to a 90% success rate for individuals that stay in our house for 12 months or more. You go to the next one. Oh, you're good. So this is a little bit more for those of you who like the data a little bit more. Eight, 897 Oxford House residents interviewed every 4 months for 2 years. Our statistics are evidence-based. 13.5% of that had relapsed. The income increased from $794 a month to $924 a month. 80% of those were employed. Less than 5% incarceration, so less than 5% of them going through recidivism, right? Going back to prison or back to jail. And that's just 87, but I believe it's more like 89 or 90% success right now. And this does not cost the taxpayers anything. If anything, it helps put money in the communities that we are in. We don't want no one's money. We're fully self-supported. We're fully autonomous in our own matters. We don't want any outside help like that. DePaul University's studies funded by the NIDA and the NIAAA. Local research, we do annual member evaluations about every April or May. We do annual member evaluations for everybody in every house all over the state. There's monthly housing activity reports that the houses do that report to their chapter to let the chapter know how they're doing. They also let the state know, what are we doing in the houses and what's working the best. Federal resources, the SAMHSA, best practices for recovery housing, National Council for Behavioral Health, state policy guide, and Surgeon General report facing addiction in America. Quick summary of all of it. Oxford House gives individuals with substance use disorder from all backgrounds a greater chance at long-term recovery. Oxford House saves millions of tax dollars. Oxford House's expansion is possible in periods of both good and poor economics because Oxford Houses don't depend on the government to run. Oxford Houses run themselves. And decades of experience and recognized by the federal government as the best program and practice. Here's a quick little flyer that we did. It was on the road to 1,000 beds, which we hit earlier this year. It's been a quick run. Oxford House Inc. came to the state in 21, where at that time they only had 88 beds. Well, right now we're still growing. We have over 120. We have like 125 houses, and we have I don't even know how many more beds, but we have more than 1,014 beds now. So I think we're in like 21 or 22 counties now. We've been expanding to other counties and areas as well.
All right, does anybody have any common questions or any ideas for Bryson?
I hope I'm not asking a question that you already answered. But what's the typical amount of time that somebody stays in an Oxford house? And then is there like a program that's designed to get them out of that and into their own place?
So typically members of the houses stay 6 months, 6 to 18 months is a typical average stay, my opinion. And that would all kind of depend on the individual. And us as Oxford House, we don't necessarily help them with that, but we also try to find these resources in the community to where we should be able to find something that's going to help every member integrate into their own housing eventually. But I will say there's no time limit on how long an individual can stay in our houses. I had a guy that just moved out of a house in Springfield earlier this year who's been there since 2013.
Anybody else?
All right, I think I have another question then. How do you refer somebody to an Oxford house? And then do they typically stay like in their community, or could somebody be sent to like a different house if there's one available in like another part of the state?
So, I mean, yeah, we accept referrals, but that individual that's being referred to the house has to be the one to call and set up their own interview. And then, I mean, yeah, we have houses all over the state, all over the country. So if I'm from Galesburg, they didn't have a house in Galesburg when I got clean, so I had to go to Peoria. I know people that move all over the place. There are people that go to houses in other states just because they want to try something different. So they would have to re-interview for whatever house they're going to if they're already in a house, but because we just don't just transfer houses, because the people in the house they're moving to need to know who they're accepting into their house, right?
Right.
But we if someone's from Effingham and they want to go up to Rockford, go for it. Set up the interview and make it happen. We're in full support of all of it.
Cool.
Anybody else? Well, I'll ask the question. How do you get an Oxford house in your community if you don't have one there? Because I know Mason County doesn't have one.
You'd have to contact the outreach workers, and we would have to do some networking in the community, and kind of go from there. I wouldn't be able to make any promises on anything because we got to check out communities, and I'm not saying one wouldn't be able to pop up here, but I don't know anything about this community, so I can't say yes or no right away. And I would also more likely bring on one of my coworkers that's been through this a little bit more than me to kind of help me figure out, what I'll look for. Because I mean, I'm still fairly new in this outreach thing. Been around doing it for almost 2 years, but I'm still fairly new. In this job, you're always learning something. So
Anybody else?
Do you know, off the top of your head, if there's one in Cook County?
yeah, we have a few in Cook County. If you want to look, if you want, you can go to our vacancy website. And on that website, it'll give you the drop down menu so you can go to which state, which county, and it'll pop up all the houses in that county with their contact, their house number, point of contact, the housing service rep's number on the house, and how many vacancies each house has.
Okay, thank you.
You're very welcome.
Yeah, Lacey, when you hop on that, it'll look exactly like this part right here. So when you go to county, you can drop down and just put in Cook County and then it'll pop up everything. Any last comments, questions for Bryson? Well, thank you, Bryson. I appreciate. Oh, Silas, go. I
Sorry,
won't
I have
say
one
no.
more. I'm seeing that
No.
in Lincoln there's 3 vacancies. So if somebody were to call today, how long typically would it take for them to be then like enrolled into the program and in the house?
So someone called today, which we've been having trouble filling the houses lately. So I've been telling everybody, do your interviews as soon as you can, as you get them. So it all depends on when they can get the guys in the house together. So honestly, I wouldn't say any more than a day or two.
Oh,
And if
cool.
that individual is able to move in right after the interview or whatever, then they definitely could.
Great.
It's actually really the whole interview process is actually really quick and painless. It's just a series like 35 questions that the houses ask, just kind of get to know the people.
Okay, awesome. Well, thank you, Bryson. We very much appreciate you taking the time out of your day to come in person and present all this amazing information about Oxford House. So if you do have any more things or questions that you have for Bryson, feel free to reach out to him. And his information, we can drop that in the chat later. So next up, we are going to talk about different events or things happening that are coming up. So the deflection program. So those who do not know what the deflection initiative is, so it is a group of different agencies that are coming together in Logan, Mason, and Menard County. We have decided to call ourselves Bridge. So building recovery, inclusion, and dignity for growth and empowerment. That is our logo. And our next meeting is Tuesday, November 25th from 1 to 3 at the health department or on Zoom. So Bridge aims to enhance accessibility to tailored services for underserved individuals needing support with substance use, mental health, and housing support in Logan, Mason, and Menard counties. Who we serve are people who are experiencing mental health conditions, including substance use. So what the whole point of Bridge is basically there will be, once this is launched, so right now we're in the stages of building this plan. We're like in the planning stage to building this entire program. And then we will be launching it hopefully, I feel like it was July or January, I think, is when we said that January, I feel January, February, I can't remember. But once we launch it, they will be hiring a oh man. Kara, if you're on here, what's the title of Tristan's job through task? Or Tyler, do you remember what Tristan, or Bryson, do you remember what Tristan's title is? No, we're all blanking. Ah.
I think is it called a deflection specialist?
Thank you. He's a deflection specialist. Thank you. That was so easy because it's right there. So, Task will be hiring a deflection specialist that will be paired up with the local police. And so that person will, so if the police come into a situation where they feel they need a deflection specialist that would help them with somebody who is experiencing mental health conditions, including substance use, they will call upon that task deflection specialist. That deflection specialist will come onto the scene and help get that person services. That deflection specialist will be with them side by side and won't leave, because the whole point of this entire program is to stop going from basically continuing all these consecutive arrests and getting people the services that they need. And so it's basically giving them that person that will walk alongside them to help give them the services. So if you're interested and you have any knowledge of anyone in Logan, Mason, and Menard County that would be great to be a part of this planning committee. We're always welcoming different agencies, but even people with lived experience. But even we're looking for champions in the community to kind of really help promote this initiative for us. So reach out to me if you have anyone, or if you want to be a part of the email listing, and we can get you on that. Or if you just want to show up Tuesday at the Logan County Health Department, you can totally do that as well. Our next recovery and action meeting, so will be December 9th, 4:30 to 6 p.m. at Hope on 5th or on Zoom. So that's a new one. We are going to do our first official hybrid meeting on December 9th. So it is always the second Tuesday of the month. It is for anyone and everyone who is open to wanting to help plan different events or help plan educational events for the community about substance use, mental health, just ways to have fun with recovery, much more. There's amazing individuals that are a part of the RIA group, but we're always looking to have more people join because more people helping with planning events make it so much easier to help implement them. So they are a small but yet mighty group. So if you want to join us December 9th, you can hop on the Zoom. I will be sending that link out closer to the date, or you can join us in person at Hope on 5th. Our next ROSC meeting will be Thursday, December 18th at 2 p.m. At Hope on 5th in Lincoln, Illinois. If you have us on your socials, please spread the word on our Instagram, Facebook, and our YouTube page. Our YouTube page has all of our meetings. So if you missed one, you can go back and watch them all. They're fabulous, so why not? So thank you from all of us, from me and Tristan and Nadia. If you know anyone who wants to get involved, pass along any of our contact info, show it so that if they want to be a part of the ROSC community, we love to, get them involved in any way. Also, happy Thanksgiving. And because we have some time left over, I do want to do some updates with any agency updates, but before, got to shout out our community survey because, why not? It is still happening. So if you have not taken our fantastic community survey, this is going to be the moment for you to do so in 5 seconds when it decides it wants to load. And if you've taken it, then you're a rock star. But that was also sent out in the email as well. But if you have a phone and you haven't taken this yet, and you work or live in the communities of Logan and Mason County, and you want to take the survey, go for it, scan the QR code. It is ending December 1st. We are pulling multiple $50 gift cards, so you have multiple chances of winning, and it's not just one. We want to get as many surveys taken as possible. The whole point and purpose of the survey is to measure public opinion on issues related to recovery and use of it to identify areas of improvement in the community. It helps with our strategic plan that we are to make updates in the end of December. So any updates that we can get and as many surveys that we can get will help us with our community survey. So for those who are curious on how many surveys that we have so far as of right now, we have 136 surveys taken. So last year we had like 356, I think. So I know that this survey was not taken so long ago. So fully understand that it's pretty much similar information that people are seeing. But if you know people that should take this, they should, because it's good information. So yeah, so share it with everyone and anyone. So I'll stop talking. So this is your chance to talk. So if you have any updates that you would like to share, this is your chance. Anyone can go. Go,
Sorry.
Lacey. You
Okay,
go.
thank you. Thanks, guys. All right, I'll just really quickly say that November is Epilepsy Awareness Month. So it's a good time if anyone's interested to do a seizure first aid training. If anyone is interested, we do offer those virtually, totally free. So I'll just drop my email in the chat if anyone is interested. If you or your organization would like to, we do provide those. So just putting it out there. And thank you guys once again.
Thank you.
Ron, you are here for updates. So if you want to give us just an introduction of who you are, who your agency is, and then our question to this month was what you are thankful for.
Okay. Ron with Sojourn Shelter and Services in Springfield. We are a safe shelter for those fleeing domestic violence. And we just finished our fundraiser for the year. We did a comedy fundraiser right at the end of October and was reasonably successful. Otherwise, we're finishing up 25 with improvements to the building and new doors, new entryways, and improvements to the clients' rooms upstairs. Thankful for, since it's right at the tail end, I just had my first anniversary with Sojourn. So thankful for Sojourn and all the staff here and their mission, and as well for you all and everything you do, and know that you are appreciated by people in the community. I hear things all the time when I'm out and about going and talking to groups, and everybody appreciates anybody that works in these realms of service to others. So thank you all.
Thanks,
And I'm
Ron.
thankful.
Thankful you are here. Thank
Thank
you.
you.
Does anybody else have any updates they'd like to share?
I'm just going to be the question guy again. Ron, since you're from Sojourn, I just wanted to ask really quick, do you guys accept people who have like pets, like dogs?
The county, let me think for a second. The APL here has, I think they call them angels, that will accept pets for clients that are staying with us. Um, I don't think it's for, I think maybe 30 days is the maximum amount of time. There are also volunteers that have contacted us, that some of the crisis managers can call. that are private citizens that will keep them as well.
Yeah, thanks. I have somebody who needs that, but the leaving their animal behind is a barrier for them. So,
Yep, yep, it's a problem. So, yeah, yeah, give us a call. Call the hotline, the 726-5200.
okay,
Artie?
thanks.
Huh?
And this is why we exist, to make those connections. All right, anybody else?
And then, Silas, if you want to just shoot me a little note of um, where the person is at, what town and such, and let me see if I can get the ball in the air.
Okay, great. Yeah, I'm gonna
Alrighty.
reach out to them too, because like I said, she's a little flighty trying to figure out what to do here. So,
Okay. Okay.
All right, well, you guys all have a great rest of your day. Um, for the end of the meeting, I would like to give one last shout out to Jeanette Davis for all of the hard work that she has done with the Logan Mason Ross from its inception to now. It would not be where it is without the hard work and dedication that she has put into it. So I am very much thankful. But just because she has left Chestnut does not mean she is not a part of the Ross. She just wasn't able to be at the meeting today. She just is going to be in a different capacity. So she's just going to be at a different agency as a different face. So she will still be a part of the Ross, which is amazing. So we're not totally losing Jeanette entirely. She will still be here, just in a different capacity. But I still wanted to fully recognize her because she is a big part of this ROSC. So everyone have a wonderful rest of your day. Have a happy Thanksgiving. Make sure to eat lots and lots of food. And I will see everyone in December at Hope on 5th or on Zoom. So have a good one, everyone. Have a great day. Thank you.